Mr. Speaker, I'm thankful that our government continues to listen to Canadians and to adjust and improve support programs based on that feedback. In that vein, I trust that we will extend the CERB, and I hope we build it out on a negative income tax model. Of course, we only face an economic crisis because we face a health crisis, and we know that the answer to the health crisis is to test, trace, isolate, and support. Yet for weeks now, we've seen less than 50% of 60,000 tests, our national daily testing capacity, go used, capacity that itself is insufficient and needs to be scaled up. While BC has managed to contain community spread, my province of Ontario has failed to test quickly, smartly, or sufficiently. On tracing, Dr. Warner at my local Michael Garron Hospital has said that Ontario is aspiring for mediocrity and called these tracing efforts inexcusable. To the Minister of Health, what are the obstacles to improving testing and tracing efforts, and how will our federal government lean in, show leadership, and help overcome these obstacles?
I want to thank my colleague from Beaches East York for an important question about testing and testing strategy. Last week, we hit a milestone of sorts where Canada completed over 1 million tests of Canadians. And although this seems like a high number, there's more work to do. We have the capacity in Canada to date to be able to test 60,000 Canadians. And we're reaching somewhere in the average of 27 or 28,000 tests a day right now. And the challenge is multiple. As we know, each jurisdiction has control over their own testing strategy, but I will congratulate all provinces and territories for working really diligently to boost their capacity to do these tests, working in partnership with local public health units, working in partnership with the public health labs. At the federal government, the work that we're doing is to support that increased capacity by ensuring that access to labs, access to resources needed for testing like swabs and reagents, and access to the ability to increase capacity around data are not barriers. And so we continue that work with our colleagues. We know that testing strategies will vary from province to province, but we are very encouraged by the progress that we're seeing to date.
The next